Hey, this is Dr. Tim. I want to talk about the aftercare protocols for the infant tongue tie release. Now, during the appointment, I've given you a packet of information. I'm going to go through, give you some of the highlights, bullet points from that packet of information. So, when we talk about the wound for the infants, I liken it to kind of a little bigger canker sore. It's an open wound, takes about 3 to 4 weeks for the wound to fully heal. As the wound is healing, it is contracting or getting smaller. All that contraction just means is tension. Inside the packet, it gives you a chart that talks about wound healing from day 1 through month 1, and you'll notice that that contraction within the wound starts to peak around the end of week 1, going into week 2 with that. So at times, it can feel tight under the tongue when the wound is healing. It's one of the primary reasons why you are taught to get your hands in the mouth, do your stretches, do your exercises to help minimize that tension, decrease that tension from coming back, and work on improving tongue function and tongue quality and strength during that first month. The first couple weeks is super important that you do the stretches and follow the protocols that your therapist and your care team provides, whether that's your lactation consultant, chiropractor, physical therapist, occupational therapist, speech language pathologist, whoever you're working with. It's super important that you continue to follow their advice. They will get into a lot of what we call more of the exercises, suck training, feeding therapy, those types of things that will continue to help your child's kind of feeding and also your goals within your feeding and growth journey with your child. I think the exercises afterwards and the therapy is just as important as the procedure itself, and sticking to the guidelines and adherence with that really helps minimize any negative reattachment from coming back. When we talk about the stretches that I demonstrated that day, and there's other videos on my website that show that, the stretches are more at helping wound healing. The exercises, suck training, feeding therapy are more to guide kind of that new re-education, new muscle memory of the tongue itself. Now, as the wounds are healing over the first month, that there can be some ups and downs with the progress. Most parents will say that the first 24, 48 hours, there's the most variability with their child. Some families say, my kid acted completely normal afterwards, kind of like if they get their shots or any other procedure done. Some families say, my baby's fussy for a day or two. So variability within the first couple of days is very normal, and the child will learn to self-regulate and relearn as they figure things out within that time frame. Some families, if their child is fussy, that like to give their child all natural remedies, some homeopathic remedies. The packet gets into some of that. A lot of families in town use the PPR drops that a local chiropractor makes. Other families will use Tylenol, all natural Tylenol. Whatever you choose, I leave it up to you. That's your choice with whatever you want to give to your child. But most families like to use something within the first day or two just to help make sure their child's comfortable and sleep is good too. Some families say that their child sleeps more, sleeps less. At times, others will say that they're within the first day or two, their child continues to kind of fight latching a little bit. They're kind of struggling to feed just slightly as they're trying to figure some things out. Very rarely are significant feeding issues like just not wanting to feed ever an issue. If things like that arise, definitely reach out to your lactation consultant. If you don't have one, let your care team know. We will provide you with a great name. The stretching protocol, I like to do around 4 a day. I'm finding that less is more within that because I want you to be able to focus on your exercises and having time to work with your care team so you can fit it in. I know it's the hardest part about the whole process is the aftercare. I've done it with my son. As a parent, it's hard to do. It's hard to get your hands in your child's mouth. And remember, you're doing the best you can. And also, that's one of the main reasons you have your support, and the support is from your care team, so they can be eyes on, watching the healing, answering questions, guiding you within your journey. Super important with that. Just remember, as a parent, you're doing the best you can with all that stuff. My team, myself, we're here to help guide you within that process. When you do 4, usually day of procedure, you're not going to get 4 of them in. I'll guide you that day on how many I think you should do, depending on the time of day. the age of your child. Typically, you'll start with your first 4 the following day. It's usually first thing in the morning, maybe noon, afternoon, evening time. Evening can be variable for some babies when they don't have a set schedule yet, especially within the first so many months of life. The nighttime ones can be really whenever you want to. It could be before bed, could be in the evening. If you're feeding, during the night, one thing that I'd like to say is you don't specifically have to, wake your child to do them, set an alarm to do them. I find that super stressful. It's going to be okay with that if you don't get one in at that time frame. Trying to make it as easy as possible, on you within your family, I find works the best with some of that. Now, families like to usually say they do their stretches around feeding time, before and after feeding time. Helps keep the baby more calm, more comfortable. Some families say that they do them when they change a diaper, or there's other cues throughout the day that help to guide you on all that. Now, the packet will also get into some kind of red flag type, issues. Thankfully, I very rarely see any of that stuff going on. If you notice anything, reach out to me, reach out to your pediatrician, your care team, midwife, whoever will guide you with anything on that. One thing that can be common, especially the first couple of days through the first week, through feeding, through during a stretch, is that there could be a little bleeding under the tongue. It's just picture the tongue lifting, the tongue pulling on the wound or the scab, and it could cause it to open a little bit. It's always minimal, but if you have questions, please reach out. A couple other things that you could notice, like babies that are purely bottle fed, or, sometimes, if they're taking a bottle within the first week, some families say they spit up a little bit more. They just need to learn how to re-regulate the flow rate of the milk, so forth. Some families may drop back in flow rate of the bottle nipple, and or nipple size with some of that. That's really the main stuff within the packet, the highlights. So please reference the information that we gave you. If you have any questions, any thoughts, you get home and kind of unsure about things, please reach out to me and my team. You can text us. You can text us photos. Is the wound looking okay? That's usually the biggest thing that questions parents ask. Is the wound healing okay? Are the stretches going all right? How much force do I use? So forth with that. So I know I have some other videos specifically on the stretches themselves, but a few quick highlights. I like to wear gloves, otherwise wash hands. I always say use a little bit more force than you think, just to be able to get your hands in the mouth and do all that. And trust yourself. You're taking, the best care of your child that you can. So stay in touch. Hopefully that helps. Thanks a lot for your trust, and good luck.